All right, so that sums it up for our common childhood viral rashes. And we're going to move on to the most common GI viruses. I'm only going to focus on the highest yield viruses. There are a number of other GI viruses. However, those are significantly more rare or just less commonly discussed. And so today we're going to focus just on rotavirus, norovirus, and adenovirus. So for rotavirus, the buzzwords are daycare outbreak, infant with vomiting, then diarrhea, and a live oral vaccine. Transmission is fecal oral. Clinical features are fever and vomiting, usually starts first. So the kiddo is going to be febrile, throwing up. And then maybe 1 or 2 days later, they're going to develop a profuse, watery diarrhea. The illness usually lasts around 3 to 8 days. There are potential complications. In fact, rotavirus in many areas of the world where vaccine is not available or it's less efficacious, rotavirus is one of the leading causes of death, particularly in children less than 5 years of age. And why is that? It's mostly from dehydration and electrolyte imbalances. So this is why oral rehydration salts are so important for so many children around the world, because a lot of death occurs just from dehydration and electrolyte imbalances from severe diarrhea. You can also actually have some respiratory symptoms with rotavirus, and afebrile seizures is a very rare but present side effect. That's 2 to 3%. You diagnose rotavirus with stool antigen testing or with PCR. So it is present on our multiplex GI panels that are common now in many areas of, in many health institutions in the United States. We have a vaccine for this, which is fantastic. This is a live oral vaccine. You give it at 2 and 4 months, and depending on which brand it is, you may also give it at 6 months. So it's either a 2 or a 3 dose vaccination in the first year of life. This vaccine is a live vaccine, so it is contraindicated in SCID or in anybody who has a history of intussusception. All right, so let's move on to norovirus. Buzzwords for norovirus: cruise ship, school or household outbreak, and explosive vomiting. Norovirus is a highly infectious infection. You only need exposure to a handful of tiny little virions to get infected with norovirus. It is fecal oral, and it can also be transmitted via aerosolized vomitus. And yes, that is exactly what it sounds like. Clinical features include abrupt onset of vomiting. You're fine, all of a sudden you're vomiting. And then non-bloody, watery diarrhea. Usually the course is pretty short. It's 1 to 3 days. Complications, of course, include dehydration. And usually it's going to have a really high kind of hit rate in households. So usually going to involve multiple family members. Testing is by stool PCR. And again, it's included in our multiplex GI panels. Other than the fact that it's extremely contagious, we do not have a vaccine for norovirus. All right, and then lastly, I wanted to talk about adenovirus. So buzzwords for adenovirus include prolonged diarrhea. So sometimes you can have a diarrhea that persists for a really long time. So this might be a kid coming into your clinic who has had diarrhea now for a week and a half. Mom is just, or dad or parent is besides themselves because they keep having to change diapers. It's not going away. They have a low-grade fever. They may have concurrent conjunctivitis and belly pain. And then another buzzword is daycare. So transmission, again, is fecal oral. And the clinical features include fever and vomiting, then followed by this diarrhea that can persist for 1 to 2 weeks. Usually it's non-bloody, and it can occasionally also have respiratory symptoms associated with it or conjunctival symptoms concurrently. So if you have a question stem with a child who has red, itchy eyes, and then has also had diarrhea now for 1 to 2 weeks, that is a classic question for adenovirus. Complications include dehydration, most common in infants and young children. You can also get a complication of a mesenteric adenitis, so essentially a swelling of your lymph nodes in your mesentery, which can cause some severe abdominal pain. Rarely you can have intussusception, but this is less common than rotavirus. And there was also an outbreak of severe hepatitis and in some cases fulminant liver failure associated with strains of adenovirus in 2022, and it still occasionally occurs. Testing is via a stool PCR, and you can also do respiratory or conjunctival swabs if they're having eye or respiratory symptomology. All right, so which virus is the leading cause of severe dehydrating diarrhea in infants and is preventable? That's rotavirus. What viral GI pathogen causes explosive vomiting and diarrhea, spreads rapidly in outbreaks, and requires only a tiny infectious dose? That's norovirus. And then which viral cause of pediatric gastroenteritis is associated with prolonged watery diarrhea, maybe 1 or 2 weeks, and may present with concurrent conjunctivitis? That would be adenovirus. Okay, so that wraps it up for our classic childhood rashes and for the most common viral GI infections in children. I hope this was helpful for you, and I look forward to the next set. Thank you so much.